The province's chief medical health officer, Dr. Saqib Shahab, says the curve is going in the wrong direction. He says recent measures like mask wearing and gathering limits, well, the results won't be seen for a couple of weeks. Right now, Saskatchewan trails only Alberta and Manitoba in active cases per capita. Shahab says if the hospitalization number and the cases don't go in the right direction, more restrictions could be on the way.
If we don't see a change in our case numbers, then we will have to go in a direction of more restrictions, which are hard for us as individuals, and it is hard for those sectors as well.
The government's most recent modeling assumes that if the majority of people follow guidelines and school and businesses remain open, hospitalizations will be at 5 per day, and there will be an average of 5 deaths per month. But in the most pessimistic scenario, which assumes people do not follow guidelines, hospitalizations rise to 677 a day, with a total of 4,800 deaths over a 6-month span. That's why the government is urging people to follow the rules.
We strongly recommend that you do not have visitors from outside your household. And beyond that, keeping physical distancing, washing your hands, reduce the number of contacts as much as possible to limit your number of trips outside your home. And stay home whenever possible. These practices that are the bridge that will get us safely from now until the day we have a widespread vaccine.
Merriman says the government expects to receive its initial first share of doses early in the new year, approximately 180,000. He says it's likely that those doses will be given to seniors and frontline healthcare workers.
We'll start in a limited amount, we hope January, February, but then we don't have good visibility of what the pipeline will be through the rest of the year, and that will continue beyond May. I anticipate that the vaccine pipeline will continue into the fall.
To keep up with the rising number of cases, the province has hired 76 more contact tracers. It says on average, a person testing positive for COVID-19 has 11 close contacts. The CEO of the SHA says that number is way, way, way too high. Adam Hunter, CBC News, Regina.